today we'll talk about a topic that is very, very important in human reproduction. So today we'll talk about ovulation. So that's what we're going to talk about today. For some reasons, this very important topic seems to be very confusing to some people. They shouldn't be, especially if you follow the little steps, if you follow the little descriptive analysis of what ovulation is. If you pay close attention to your body, you'll be in a better position to at least see if you can study the pattern of your body. So I'm going to talk about ovulation, and I'm going to talk about how to calculate your ovulation, and I'm also going to talk about few signs and symptoms that might tell you you're ovulating. Unfortunately, some people will not have a clear-cut pattern of their menstrual cycle and ovulation. Unfortunately, not everybody will have the signs. But when we talk about it, you can know exactly how to start paying close attention to your body. Ovulation is an event, a special event that happens in every woman's body within their reproductive cycle. So I'm going to start right away. So you see, a woman's body, it's very unique. Once you hit your puberty, there are a couple of changes that happen in your body. So when you were born with some specified number of eggs. These eggs are actually what's gonna make you reproductive and actually gonna make you productive. So by the time you turn into a teenager and by the time you start having your first menstrual bleeding, you would have already started your reproductive cycle. So you're actually born with specified number of eggs. These eggs are what you will use to procreate. So there are three important phases in a woman's life: the menstrual phase, the reproductive phase, and the menopausal phase. So by the time you start seeing your menstrual bleeding, you're actually ready to start having your own family. This function terminates when you hit menopause. By the time you're menopausal, you're no longer able to have a baby on your own. You can actually still have babies, but you have to have that with assisted reproductive technique. So what is ovulation? So you see, in a menstrual cycle, so a menstrual cycle starts from the very first day you bled to the very first day you will bleed in the other cycle. So let's say you bled 1st of January. You start counting from that day until you bleed again in February. So the interval between the two periods is your menstrual cycle. The regular menstrual cycle is 28 days. That's the standard menstrual cycle we use for our teachings. So ovulation is simply a special process that happens in a woman's body. So during ovulation, what happens is one egg will be released from the follicles in either of the ovaries. So like I mentioned, when you're born and you're a woman, you're actually born with a number of eggs you're supposed to use for your reproductive functions. But until you turn into a viable reproductive lady, these eggs are not going to be fully functional. So each time you bleed, each time you have your menstrual bleeding, is actually a sign that you're actually viable. So ovulation is that special day, that special process that happens within a space of 12 to 24 hours, where one of your ovaries will release an egg. In some situations, you can release more than one egg. So the whole of that process is called ovulation. That's simply what ovulation is all about. Without ovulation, you cannot become pregnant naturally. You have to ovulate. You have to release the egg. The egg has to be viable before the sperm will meet the egg, and the process of fertilization will start. There are some key signs of ovulation in a woman. But please pay close attention. Not all the women will have all the signs. Some women will not have any signs and they will still ovulate. Some women will have some signs and they are not ovulating. But there are key signs you need to be on the lookout for. One of the important signs is egg white cervical mucus. So within the time you're ovulating, you notice a kind of a consistency of egg white discharge. Some women can have bloating, some women can have mid-cycle pain, some women can actually have spotting, some women can have mood swings, some women can have increase in their basal body temperature. So within that period you're ovulating, you will notice that your body temperature is a little bit slightly increased. There are key hormones that play a role in ovulation, and all these hormones must be in a particular regular normal range for ovulation to happen properly. So we'll start with what we call FSH, follicular stimulating hormones. So these are the hormones that will help the follicles. The follicles are like vehicles that carry the eggs. So the eggs are contained inside the follicles. Then you have the LH hormone, the luteinizing hormone. Matter of fact, LH hormone is the hormone that once it rises, we'll call it LH surge. Once it goes up, the chances you're going to ovulate within 12 to 24 hours is very high. That's actually what we check in ovulation test kit, LH hormone. So when you release this egg, that's what it's called ovulation. So in a woman that has a regular 28-day cycle, somehow we figured out that we can apply factor 14 to decipher when you are actually going to have your ovulation. So when you apply factor 14, the very first day you start bleeding, you count 14 days down. So let's say you started bleeding on January 1st, you count 14 days. On the 14th day is the day you're likely going to ovulate. This is based on the assumption you have a 28-day cycle. If your cycle is not 28 days, please still apply factor 14. Let's take, for example, your cycle is 30 days. When you minus 14 from 30, you're going to have 16. So for a woman that has a cycle day of 30, instead of having an ovulation on day 14, she's going to have ovulation on day 16. In the same vein, if you're 24, 26, 27, 25, all you need to do is to apply factor 14. So minus 14 from whatever cycle you have, and that period you will get will be the tentative likely day you will ovulate. That's very easy. But some women are not lucky. Some women have irregular menstrual cycles. Some women have irregular periods for some reasons. It can be hormonal imbalance, it can be stress, it can be infection. There are so many things that can lead to inability to have regular predictive cycle. If you're in this category, my advice is to work with your gynecologist so we can figure out how to be of help. Some women also have short cycles. So the most important thing to note is the fact that irrespective of your friend's ovulation cycle or your mother or your sister, your ovulation cycle is unique. So your sister might have 28, you might have 27, you might have 26, and it can fluctuate. So you can have 28 this month, you can have 27 next month, you can have 26, but the key point is to find the average. To know in the middle, go in the middle. Once you can decipher when you ovulate, your journey to pregnancy have actually started. Because when you know when you ovulate, you can predict your fertile window. So the fertile window is the period you have the greatest potentials of becoming pregnant if you have unprotected sex with your partner who is also viable. So your fertility window starts from 5 days before the ovulation. The reason why it starts from 5 days is the fact that the sperm, which must be viable, which must be healthy to cause fertilization to occur, can survive in the body of a woman, in the vagina, for up to 5 days. So if you meet with your partner 5 days before your ovulation, that sperm can still fertilize the egg. So your fertile window starts 5 days before the ovulation, and a day afterwards. So it's about a period of 7 days. So if you meet with your partner and every box is checked and your partner is good, you're good, the chances of you getting pregnant within this time frame is very high. Some people will not have this straight curve. But let me say this. For every woman, she can become pregnant anytime in her menstrual cycle, including during her menstrual bleeding, especially for women that have a short cycle.